Can you guys all hear me okay? When you come onto this, so this is what you'll essentially be seeing. If you click onto the actual name interview hall and then press this chat logo in the top right, then you can access the text channel for this session. So you can tag along during the event and ask any questions, etc. We'll get started in a few minutes. Hi Katie, yep, just making sure that everyone can hear me and everyone can see this text channel. You just go over to the name of this, which is interview hall. You're then going to press the chat icon up here, and then you'll be able to access this channel. If you can just put a hello in there to let me know that you can access it, that'd be great. How many of us are there? There's about 7 of us. Okay. Just going to wait for a few more people to get started. I'll make an announcement as well. Yep. Please make sure you can access the text channel because that's where everything's going to be. If you've just joined up, make sure your microphone's muted and you can see its text channel here. You want to click on this, the name of the channel, and then you want to head over to the message bit here. And then you can access this channel right here and tag along. But yeah, I'll be back in about 2 minutes and then we'll get started. Just waiting for a few more people to join up. Hello to all the new people who've just come. We're going to get started in literally 2 or 3 minutes. We're just waiting for a few more people to join up. Just waiting for a few more people to join and then we'll get started. There were 75 sign-ups roughly on the Discord. So I'm going to wait for roughly that many people to come. But we'll get started at roughly about 5 past. Sorry for the delay. Can you all check for me that you can access the text channel to accompany this event? So you just click on the name of this voice channel, interview hall, and then you press the text icon that comes up next to it. Then you can tag along during the event, ask any questions, etc. So make sure you can access that, please. Hey guys, just realised I've been muted and talking to myself like an idiot for 3 minutes, but hopefully you can hear me now. Can you all hear me now?
Yeah, I can hear you.
Awesome, okay. So what I'm saying is, we're going to start in a few minutes once a few more people have joined. There's like 75 people signed up. I've got 35 people on my TikTok live, so we're going to have a few more people join, then we'll get started. So just give it 2 or 3 minutes. I envisage the event lasting for about 25-30 minutes and then a Q&A on top. So get yourself a notepad, get yourself a bottle of water if you want, just get ready. We'll just go back to this. Will I be recording this? Unfortunately not, no. Because I'm doing it on my tablet, I'm not on my computer at the moment, so I can't record it because you can only either stream or you can record. You can't do both of them, annoyingly, on Android. Where's the event? It's on UK MedApps, the Discord server, bit.ly/UK MedApps if you want to join. If you are watching it on TikTok, I can see the questions, but I can't see them as well as I see them on the Discord. So if you want to make sure your questions get prioritized, just ensure that you join the Discord server and ask them from there. And if you're on the Discord server already, then just send me a message if you don't know how to access the channel. But when you go on the name of this channel, Interview Hall, there should be a little chat icon that comes up next to it, and that is the chat for this event. But yeah, we've got a decent number of people now, about 15 of us, and then there's quite a few people on TikTok as well. So we'll get started with the event. So today's event is essentially about motivation for medicine and dentistry, and it's a really, really important thing to know about, because when this is something that is essentially going to be tested in your interviews 100%. Like, the water is wet, this is going to get tested in your interview. It's one of the first things I'll test, or it's one of the last things I'll test. You will have to speak about this during the actual thing. So it's really important that you nail it down. And when most of you are starting off your interview prep, I'm sure that you're beginning with this topic as well, because it's easier to begin with. So if you can get good at talking about your motivation to study medicine or dentistry, then it will help you a lot in the other things you need to talk about. And essentially the plan is for this series that I'm doing, I want to go through a different theme every single week, and each week we'll cover a different theme. So I'll have a teaching session like this in the week, and then a practice session on the weekends where I can ask you guys questions. Some other medical students will be there, and we can just sort of help each other to get better at answering these sorts of questions. Will each week be at this time as well? I'm trying to roughly keep it at the same time, but I think I might have done it a little bit too early today, because it's only 4 p.m. and I know loads of you guys finish school at like 3:20, 3:30, so I might do it a little bit later next week. But I'll always let you know like 1 week in advance roughly what the time's going to be. Is this time okay for you guys, or do you want to change it, or let me know? So the aim is, I want to do about 6 or 7 sessions. So one on motivation, one on ethics, one on professionalism, one on basically every theme that you can get tested on in your interviews. Okay, yeah. And then in future, I'll try and record it as well, so people who can't join can hopefully benefit from it as well. But yeah, this is motivation for medicine dentistry. Let's get started. Okay, yeah. So here's what roughly I'm going to cover in today's session. The first part of the session is going to be what questions can actually get asked to you. So we're going to take a look at some example questions which can be asked regarding your motivation for medicine or dentistry, and essentially just think about how can we go about answering these. Then we're going to say, what can I include in an answer? So what content you should include, what order you should go about it, the structure and the details, basically everything that makes a good answer. After that, I'll go over some important tips for questions. So how can I go from making my answer from good to great? This is a problem that I had quite a lot at the start of my interview prep, because I would say, yeah, okay, this answer's okay, but I know it can be a lot better. I'm just not sure how. So I'm going to go through that as well, and how essentially I made that transition with my friends. And then we'll take a look at a few more example questions and their answers. And what we'll do is, we'll take a look at those answers together, and you guys can let me know in the chat what you think of the answer, what improvements we can make, and essentially, you'll be able to analyse an answer on your own. And not only does it allow you to see what a good answer is and what a great answer is, but it also allows you to be a lot more critical of your own answers when you're in an interview preparation situation. And then we're going to think about something I briefly just touched on. How can this help other questions? So motivation for medicine is really foundational when you're talking about it in your actual interviews, and it does help your other questions quite a lot. So I'm going to talk through a mindset that will help you to sort of think to yourself, yeah, this theme is motivation for medicine dentistry, but I can transfer over these talking points to other questions. And then we'll finish it off, we'll wrap it up and have a Q&A. So yeah, if that sounds good for everyone, we'll get started. And of course, if you want more sort of content on interviews, etc., please do check out my TikTok at iHelpMedApps. And we've also got the UK MedApps Discord, which is this place right here. I'm seeing a lot of new names here. If you haven't used this Discord before, make sure you try and explore it afterwards a little bit, because honestly, it's really, really good. And I don't think I would have gotten into medical school without it. Essentially, the prep that these guys do, the sessions that they do, me doing this session now is just a way of saying thank you for all the things the server did for me. So yeah, make sure to check out my TikTok and to check out this Discord server afterwards. But without further ado, let's get started. Oh, actually, before we get started, yeah, let me know in the chat, is this text clear? Because I have set it to the maximum quality and whatever, so I'm hoping that it's nice and clear for you guys. But if not, then let me know. Have you found the chat, yeah? So everyone who's in this call right now, I'm hoping that you found the chat. If you haven't already, You just, if you're on computer, you bring your mouse on top of the name of the channel, Interview Hall, and press Open Chat. If you're on mobile, you tap Interview Hall, and then you press the chat icon, and it'll take you over. And that allows you to sort of talk to me during the session, and essentially, yeah. So yeah, right now we are live as well. I'm streaming this on my TikTok at iHelpMedApps, and of course, it's also, I did want to record it, but unfortunately not, because I've not got it set up, but hopefully next week we will. And when will this be over? It's going to be roughly about half an hour and then a Q&A on top. So without further ado, you will get started. Thank you very much. So, motivation. It's a foundational question that will set the tone for the rest of the interview, and it's almost a given that you have to talk about it. So when you're thinking about an MMI station, it's either going to be, like for example, in one of my interviews, motivation for medicine itself wasn't an MMI station, but no matter what station you started off on, that you all began with the same question about motivation. So in that sense, it might not have its own station, but it's something that will definitely appear. It's often a warm-up question. In another one of my interviews, they just asked it me as a warm-up question and then got to the actual real stuff, but it's definitely going to appear. And getting good at this allows you to get good at other stuff. So being confident with this question and having the security to know, yeah, I am really good at this question and I know how to answer it, it means that you'll often have a little bit of room to slip up on the harder ones. So if you can get good at the easy stuff, you don't have to worry about the harder stuff as much, is what I'm saying. Next slide. So what do these questions actually look like? Let's take a look at a few examples of how these questions can be phrased, because they're not very obvious when you look at them from far away. So, the same concept is being assessed in every single one of these questions. Here are some examples. Why medicine? Why not nursing? Where did your initial interest come from? What skills do you have for this degree? Do you know what it entails to study medicine? What would you do if you were rejected? What did your work experience show you? And why are doctors important? All of these questions right here, they are asking essentially the same concept for you to talk about. So they're all asking you to talk about why do you want to study medicine. But if you look at them initially, just from the surface, the way in which they're phrased can be quite difficult to understand. But the more you practice, the more you'll realise that, yeah, these questions are all kind of asking the same thing. I just need to rearrange what I'm saying a tiny bit, or I just need to add this onto the start of my answer, that sort of thing. So we're going to go through a bunch of these questions, and we're going to essentially I'm going to tell you a mindset that will allow you to answer all of these questions with ease and not worry about it, okay? So there's two parts to answering a medical school or dental school interview question: the theory and the application. And the theory is essentially knowing what to say, and I'll talk you through the talking point system, which is essentially allowing you to transfer your talking points between questions in a bit. And the other half of your answer comes from the application. So the structure that you use, the way that you say your answer, how you accompany it, and more, it's arguably a lot more important than what you're actually saying. So these are the two parts that make your answer: the theory and the application. And in my opinion, they're just as important as each other. It's great to know what to say, but if you're not saying it with confidence and actual good execution, then it's kind of just as bad as not knowing what to say, but saying it with confidence. So in that sense, they are really, really important. And if you say something bad confidently or say something average confidently, it's arguably a lot better than saying something really amazing terribly. And this skill of application is one that you'll develop over time. It's not something that you're just going to have straight away from the get-go, but the more time you put in and the more effort you put into your interview prep, the better you'll get at essentially the application side of things. So if you're struggling right now, it's very easy to say or not know what to say or to get flustered. Don't worry, honestly, because I was the exact same way when I started off. And I think every medicine applicant and medical student and dental student right now started off in a similar position. So you might be sat there thinking, yeah, I tried to answer this question, but I was really bad at it. Don't worry, okay? You're just starting off with your prep, and it's not something to be worried about. So let's look at this generic sort of thing that I want to cover straight away when someone answers why medicine. And you might see it in a lot of these online TikTok answers and terrible answers online. A lot of people are just going to say, I want to study medicine to help other people. Can you guys think of any reason why you shouldn't say that? Because it's something that you shouldn't say at all. Let me know in the chat, why would you not want to say this? It's boring, Facey, that's right. Man, very, very good. Hit the nail on the head. That's what I was looking for. There are other careers that do that. A, there's loads of careers that help people exactly. Flex, Katie saying it's cliche, very well done. It applies for many degrees, casually blue. Fresh Prince saying it's generic. Aria saying there's so many careers. Away saying that it's too broad. Busy focusing saying you can help anyone by doing any job. Exactly this. So when someone says this, you can say back to them straight away, so why don't you want to be a teacher? So why don't you want to be a police officer? So why don't you want to be a barber? Exactly this. Exactly. So this is why you shouldn't say this, because it's generic and it's boring and a million people have yapped about it before you. But on top of that, it's just not adding to your answer at all. You want to talk about it. When you give your answer, think of it from an interviewer's perspective, right? You're going to be sat there all day, probably for a couple of weeks, and you're going to be asking so many kids the exact same question. And think about how many of them are going to come along and say, I want to study medicine to help other people. It's just boring. It's just generic. Don't say this, please. If you're going to take one thing away from the session, it's to not say this in your interview, because it's just generic. But now you're thinking, what do I say then? Let's get onto it. There's 3 components of your why medicine answer or your why dentistry answer that sort of bring it to life. And essentially, if you are answering this question, you must mention all 3 of these things, in my opinion. Otherwise, you may as well have not turned up to an interview, okay? It might not be that drastic, but these 3 things right here are the holy trinity of answering your why medicine or your why dentistry. They're so, so important. You've got your introduction, which is essentially what started off your interest. What did you want to preface your answer with? Is there something that you want to say to your interviewer that they'll remember for the rest of the answer? Because remember this as well. Like, put yourself into the shoes of the interviewer again. You're speaking to 30, 40 annoying kids that day who are going to say the same thing. You're only going to remember the start and the finish of what they say. Because in the middle, everyone's going to have this work experience waffle, volunteering waffle, I attended this seminar waffle. Everyone's going to have this waffle sandwich patty in the middle. But the bread on the outside is what makes you different. The introduction and the conclusion. So if you can make an impression in those 2 points, it's really, really good. Okay? So that's why your introduction, it's not just, well, my initial interest in medicine came from boring. You want to make it something that hits hard. You want to make it something that's striking. You want to make it something that separates you from the rest. Now, I'm not saying you go and say something terrible in your introduction that's just going to make them say, why are you applying for medicine for? You do not seem like the type of person who should be a doctor. Not like that. But you want to say something that just separates you from everyone else. And for a lot of you, that's going to be a similar way to in which you started your personal statement. Something unique. And I'll go through an example answer. I'll go through 2 example answers, actually, that sort of highlight this. But your introduction is really important because it's the first time your interviewer is going to know anything about you. Then you've got your WEX. You'll see me using this acronym a few times in the PowerPoint because I couldn't fit in the full word, which is work experience. This is something that's really, really important as well. So you want to be mentioning this no matter what. So when you go into your why medicine question, you should be thinking to yourself that these are the 3 things that I will not leave the room without mentioning. Your introduction, your work experience, and your volunteering. So your work experience, it doesn't just say, yeah, on your website it says that I have to do some work experience, so I did it. That's the wrong approach to have about it. Instead, you should think of your work experience as an opportunity for you to find out more about medicine or dentistry. Okay? So don't just say, yeah, I only did, well, you might think to yourself, well, yeah, I only did the work experience because it's necessary to get into medical or dental school. But you shouldn't be saying that to the interviewer, obviously. You should be saying genuinely what made you want to do the work experience in terms of finding out more about medicine or dentistry. So, how did you gain a deeper insight into medicine or dentistry is what you want to get from your work experience. And finally, your volunteering. What skills have you got that make you suitable? So it's what's really, really good, and I'll talk about this later on when I'm talking about structuring your answer, is the transition between your work experience and your volunteering. Because it's great to say, yeah, in my work experience, I saw this skill and I saw that skill, and it was really, really good, and the doctor needed this and the dentist needed this. But then to say, yeah, and actually in my volunteering, I developed that same skill and I worked on that same skill, and that could translate over to a career in medicine or dentistry in the future if I work on it. That is a really, really strong link that you can make. So I'll talk more about that later on, but just keep that in mind for now, okay? These 3 things should be in your answer. So, a brief story is what you should think of as your introduction. You want to tell a little tale that gets the interviewer to know about you. You don't want it to be generic and say you want to help people. You want your introduction to be a nice little story and something that captures you know, a lot of you all have all done English at some point and written something that captures the reader, and it's kind of similar to an interview. You want something that captures the interviewer. So I initially wanted to study medicine because of something is a generic opener, and when reading personal statements and reading introductions, I read over 150 of them, and I was sick of reading this. I initially wanted to study medicine because of something, like my granddad was in hospital, or I did this when I was younger, or I've always wanted to be a doctor. It's really generic, and again, put yourself in the shoes of the interviewer. It's just not something that's worth writing or worth saying in this context, because you're just going to be not differentiating yourself at all from the other candidates. So start off with something that's not generic. You want to have something that's semi-striking that allows the interviewer to actually remember you. You've got a question? Yeah, go ahead. I'll continue with this and I'll hopefully just wrap up all the questions at the end, but if there's something that links to what I'm saying now, I might end up answering it. But feel free to put it in the chat. So, this is like one of the most underrated things when people tell you about how to answer this question. It's the flow between your points. So, I told you before, you want to have an introduction, work experience, and volunteering, and then I've now added in a conclusion. But the links between those points is arguably, in my opinion, as important as the points themselves. And it's kind of like your personal statement. If I reviewed your personal statement, you will have known that I told you about flow between points and how important it was. And it's the exact same thing in your interview. Having flow between your points and having a transition between your points is really, really good, because it allows you to move from one point to the next in a really smooth fashion, that it just adds a very subtle tone of, I'm confident in how I speak, I know how to talk between things, I know how to move from one thing to another without actually making it seem terrible, without making it seem good, without making it seem forced. Your flow between your points is really, really important. But how do you actually do that flow? So let's start off with the introduction. So obviously your introduction is the first part of the answer. You're not going to have anything flowing to it, but you will, from your introduction, have your work experience flowing. So in your introduction, you explain your initial interest and you say, for example, my grandfather had TB and I was exposed to the hospital a lot. That's just a generic opening. I'm not saying you need to put that. I'm not saying you should put that. But I'm just saying, let's imagine this is the opening of our answer to why medicine. We begin it off with our initial interest, and then we want to have a smooth transition over to our work experience. So you don't just say, I initially became interested in medicine because of this, and then say, I undertook a work placement, because that is completely the opposite of what I'm saying here. What you want to be saying is a link between your introduction and your work experience. So you say, my grandfather had TB and I was exposed to the hospital a lot, and this led to me becoming very interested in the healthcare environment. After doing a little bit of research online, I became quite interested in medicine, and to find out a bit more about it, I undertook a work placement at St. Mary's Hospital. That is the kind of way you want to be going from your introduction to your work experience. It's not just, this is one point, this is another. It's, this is one point, it threads on nicely, and this is another. Okay? Do you guys understand that? Let me know in the chat. Awesome, yeah. So when you have these points, you want to have flow in between them. And this again comes on to the idea of application as opposed to theory. And this is one of the parts of application. Flow between points is very important. I've just got a question here. What if I have work experience in other areas, but it's not directly linked to medicine? How would I include it in my answer and make it flow? Am I going to upload these slides? Yes, I am. I'm just thinking about this question here. What exactly is your work experience about? Is it really, really distant from medicine? Because, of course, there are skills that are present in loads of careers that are present in medicine as well, so you can do it that way. I'll just go on to the next bit and come back to you after, eh? So you've talked about your work experience and you've mentioned your introduction. Now you're thinking, so you talk about your work experience and you begin it off by saying, I saw many things, but something that particularly interested me was this, or however you want to talk about your work experience. You talk about it, and you finish off talking about your work experience. How do I then go to talk about my volunteering? You start off your volunteering by saying, and let's say you talk about your work experience and you say, and I saw communication within medicine, and it was really important in ensuring this patient felt cared for and felt as though he was safe and felt as though he could place his trust in the clinician. And the skill of developing a rapport and the skill of communication is one that I've actually developed myself during my volunteering. You guys can see that transition, right? It's not just saying reflections from work experience and then saying, oh yeah, and I've done some volunteering and I developed this skill. That is not the way you want to go about it. You want to be saying, I saw this skill in my work experience, and it's also one that I've developed in my volunteering. I have pharmacy and dental work experience, and I want to do medicine, and my initial exposure was to MND. So how could I link these? Okay, you can link it to the general overall healthcare environment. So you can say, I explored the healthcare environment by doing and then say I looked at a dental practice and I looked at a pharmacy, and then you can say I did some further research online and spoke to some junior doctors and found out this about medicine. Okay, so the skills that you see in pharmacy and dentistry are of course really, really important and really transferable over to medicine. But of course, if you've not got medical work experience, it's totally fine for you to say that you have general healthcare work experience. For example, one of my friends, he didn't have medical work experience either. He actually had work experience where he was shadowing a pharmacist, but he used that and got into medical school and said, yeah, well, during my pharmacy placement, I saw the skill of empathy when the pharmacist was having a consultation with a worried patient. And of course, this is really important within medicine because blah, blah, blah. Does that make sense? Generally, healthcare professions have got the same skills that can be transferred between them. So in terms of work experience, don't worry about it. Perfect. So you've talked about your introduction. You flowed nicely to your work experience. You then flowed nicely over to your volunteering. And now you want to finish off your answer. How do you do it? So you've said that, oh yeah, and I developed this skill myself during my volunteering in a care home. I had to speak to many elderly patients, and speaking to them meant that I had to adapt the tone of my voice depending on who I was talking to, and this was of course really important for developing a rapport with them. And then you want to finish it off. But how do you go from talking about your volunteering to actually concluding? Well, here's how you do it. You just finish it off with something like, and this is why I would like to study medicine or dentistry, in the sense of, okay, so these are the skills that I've shown. So I showed, and these skills that I've got are ones that I wish to transfer over to a career in medicine or dentistry. So purely because of my current skill set and its transferability, as well as the fusion of the science I've always enjoyed, I would like to study medicine or I would like to study dentistry. Now the points that I've just said there are you having skills already and you enjoying chemistry and biology and wanting to fuse them together. But for you guys, you can say whatever you want to. Those don't have to be the same points that I said. And if anything, how many of us are there? There's about 20 of us. I can't really see. My monitor's a bit small. But there's loads of us here. If you all say the same thing, again, it's not really going to look very good. So make sure your answer is unique in that sense. So it could be absolutely anything and say, and yeah, it was actually, you can link back to the beginning and say, and yeah, it was actually from this initial exposure that I had, I always had an interest in medicine. And the more that I found out about it, the more it appealed to me and the more I was attracted over to it as a career. And hence that's why I would like to study medicine at university. And from that tooth extraction that I had when I was a child, I did some work experience and thinking about the skills and reflecting upon the skills that I have and how they would be so useful in dentistry and my ability to learn and pick up new skills, I would like to study dentistry to combine my interest that I've always had with the skills I'm currently developing. Does that make sense? Okay? This is very, very conceptually challenging at the start because it's kind of hard to think about how do you transition from one paragraph or one topic to the next. But it's very, very important. So does that make sense to you guys? Let me know in the chat. And if you are on TikTok and you want to participate in the chat, then just join the Discord server. It's bit.ly/UKMedApps. I'm getting a lot of yeses, okay? Don't be afraid to say no, guys, by the way. The whole point of this environment is that if someone's struggling on something, we can help them out, and that same person can use their strengths to help you out when you're struggling, alright? That's the whole point of the Discord server. But yeah, I will swiftly move on now, because I don't want to yap for too long. So that is your structure. And that is how you flow between points. And now I'm just going to talk about some really important tips and advice that I wish I had when I prepared for this theme of motivation for medicine and dentistry. So let's just get on to them. These are some wisdom pearls. I know that's a very bad pun on my behalf, but I was trying to impress the dentists. I hope you can appreciate that. But these are some pearls of wisdom that I would want to pass on to you guys if I was starting off my interview prep right now. So, pauses. You might look at an interview and a person starts off with, could I just have a moment to think about that? Or, let me just have a moment to think about that. Or, can I just ponder for a second, please? And you might look at it and think, oh, that's not very good because he doesn't know or she doesn't know what to say straight away. Can you pause like every question at the beginning? Of course you can, yeah. If you're pausing, from an interview's perspective, let's think about the two options that you've got. You can either jump into your answer straight away without thinking and sort of just yap for a bit and not really give the most thoughtful answer and not really give the best answer that you can. Or you can take a 5 or 10 second pause, think about your answer, and then actually give a really good answer. And you'll actually do a lot better. And in that sense, you're never going to get marked down for pausing. It just shows you're thoughtful when you answer, and it just shows that you're thinking. So no, you can pause at the start of every question, and I think I did that too. In all of my interviews, I paused and just took a moment. Sarah on TikTok, I was just thinking, what have you said? I want to take a gap year and apply to medicine. I was just thinking of getting the grades. Yeah, there's loads of people that do that. A lot of people in my year, you'll be surprised actually, in medicine, how many people do take gap years. Because even in my year right now, so many people took gap years, and there's some people there who've taken 2 because they wanted to reset A-levels, or they just didn't get in. There's loads of people that take gap years, so if you just want to focus on your grades right now and then apply this content next year, that's more than respectable. Loads of people do it. Will they not consider it as us not being confident? No, they won't. Because if you go on and say a really confident and thoughtful answer, how can they say, oh, well, this guy took a pause at the start of the question, so he's not that confident, is he? They're not going to say that, are they? So yeah, take your time, pause, think about what to say, and then say it, okay? Because at the end of the day, you've only got one opportunity to really say it, so you want to make the most of it. And if that means taking a little pause, then so be it. And this pause can be as long as you want, really. It can be 2 seconds, it can be 5, it can be 15, it doesn't really matter. And what you'll also find is that at the start of many MMI stations, you're given the question in advance. And for example, I know this was how it was at Leeds and at Manchester. You could read the question beforehand, and then there'd be a little beep between the times of you getting the question and you being able to answer it. So in that sense, you might not even need a pause. But if you do need one, it's perfectly fine. Second thing is, even for Leeds Dentistry MMI, I'm not too sure about the Dentistry MMI. I'll try and ask my friend who did Dentistry Leeds application. I'll see if I can find one. But I think generally, if a university does medicine and dentistry, the interviews are basically identical in terms of format. There's no need for them to change them. But yeah, for Leeds Medicine, they just put the question on the screen and they said, okay, you've got 2 minutes to think about it. And then they said, all right, now we want to ask, then they just read the question out loud and say, okay, here's the question, you've got X minutes to answer it. So yeah, they shouldn't have any reason to change it between medicine and dentistry. So confidence. You guys who are all in this call right now, you're doing a lot better than the people who aren't here. And you might not think that, but yeah. Wait, not always. With Bristol, the med, it's some different to dentistry. Yeah, fair enough. It depends on the university. But I think, I'll ask my friend who does dentistry at Leeds, and I'll get back to you, yeah? I'll ask my friend who does dentistry at Leeds, I'll ask her. Yeah, Bristol medicine interviews, they are something else I've heard, but we won't go into the details about them. So confidence. This is really important, and it's not really something you can just inject in yourself. You don't just wake up one day and say, yeah, I'm going to be confident from now on. But what I want you guys to all remember is, first of all, you guys are giving up your Friday night to come here and prepare for interviews, which is pretty good. You might be thinking, oh yeah, well, my mate at school's already finished half of the ISC medical schools book, and he wrote this essay when he was a sperm cell and all this and that. Don't feel imposter syndrome, okay? You, compared to other applicants right now, are in the exact same position. You've all written a banging personal statement. You've all done the UCAT and scored well enough to get an interview. Or you've done the BMAT and scored well enough to get an interview. You're all doing A-levels or IB or whatever equivalent it is, and you guys are all managing this effectively. So don't think to yourself, I don't really deserve to be here, or I'm not very confident in myself. You guys deserve to be in that interview as much as every single other person there, if not more, okay? So you've done all this work, and this is the second to last hurdle that you need to cross, alright? So, remember that. You're not there for no reason. You're there because you're good enough on paper. All you've got to do now is translate that to being good enough in person. So don't worry. Be confident, and just treat it like a conversation. And I'll talk a bit more about how you can humanize this interviewer in my next point, which is human interviewers. So, although they might be sat opposite you with closed body language, a straight face, interrupting you, being really mean, at the end of the day, they are human too. And they've just been told by their superiors, you're going to be interviewing today, I want you to extract information out of this guy. And that's what an interviewer told me when I spoke to him. He said, we have to show no compassion or no emotion, but at the end of the day, all we're doing is just our job. We're just trying to extract information out of people. Laws priv, what A-level should I study? You should study chemistry and biology combined with something else if you want to apply for medicine or dentistry. but it depends on the university itself. But yeah, if you're still choosing, choose chemistry and biology and something else that you find easy or enjoyable. But yeah, the interviewers at the end of the day, they are human, and you can talk to them and you can essentially help them with their job. So if an interviewer does interrupt you, and that will happen ultimately, don't take it as a knock of your confidence. Instead, take it as, okay, you're going a little bit off topic here. I'm going to ask you a different question and help you get back on track. That's what you need to think of it as opposed to he's interrupting me or that she's interrupting me, I'm not doing very well. Interviewers have got a job. They're very good at it. And if they are doing something, it's for your benefit. They've got nothing against you. They might appear like they have, but they have nothing against you at all. And all they want to do is get as much information out of you as possible. So don't feel afraid of the interviewers. And of course, it does vary from med school to dental school, etc. For example, in one of my medical school interviews, my interviewers were really friendly and nice and they were chatty with me. But in another interview, they were a lot meaner and sterner and didn't show any emotion. What if you start waffling and forget the topic? How can you get on track without feeling embarrassed and messing up the interview? It's perfectly normal to do that. It's perfectly reasonable to do that as well. And if that does happen, all you got to do is just think, either the interviewer is going to stop you and say, can you get back on track? Or can you please elaborate on this point for me? Or you've got to realise it yourself. And if you do realise it yourself, all you do say is, oh, well, I've gone into quite a lot of detail about this because obviously I'm quite passionate about it, but I'm going to go back to talking about this now. And then they'll just say, okay. Or you can just yourself stop in the middle and take a pause. Like I said, taking pauses is completely fine, whether that's at the start of a question or if it's in the middle, okay? And if you don't want to pause, because I know a few of you expressed concern like that, and you said, well, what if it makes me look bad? Or what? I'm a little bit worried about making pauses. You don't have to take pauses. Instead, you can use what I call in my head filler phrases. So when I'm talking now, just because I've done quite a few interview preparation sessions, and I've done loads of medicine content on my TikTok, I don't actually take pauses in the sense of saying or or I don't really use things like that. But instead what I do is I've developed the sort of skill to use filler phrases. So instead of me taking a pause or me actually stopping talking or me saying or all I do is essentially fill up the gap with random words that are sort of related to what I'm talking about right now. So it's not something that you can sort of set out about doing, but just keep it in the back of your mind and think, yeah, instead of taking that pause, is there something that I can fill this gap with instead? On my TikTok, can a 40-year-old IT graduate study medicine? Yeah, you can study undergraduate medicine if you didn't take the right A-levels, I think. You should be able to apply for medicine with a foundation year, or there are quite a few different pathways to medicine. It does vary university to university, so make sure to check that out for your individual scenario. So talking a little bit more about the role of an interviewer, they've got 4 main sort of rules or 4 main things they've really got to stick by and they can't deviate away from. And the first one is secrecy. They don't want to give the game away. So that will mean if they have got an answer sheet, they're going to be hiding it from you. If they've got any emotions, like they're enjoying your answer or they're not liking your answer, they're going to hide it from you because they don't want to put you off or they don't want to encourage you to talk more about a point that's on the mark scheme. They want to see you completely raw for what you are. So that's a very important thing to remember. So if you're saying something, and with your friends, obviously, you'll get head nods, or you'll get little smiles, or you'll get little, that's not the right thing, or little looks of disapproval. With your interviewer, the likelihood is you're not going to get anything at all. And if you do get anything, it's going to be on the negative side, just to throw you off, because they're not having a good day. So whatever an emotion an interviewer shows, just remember that they've been trained not to show any. The next thing that an interviewer does is extraction. So they want to answer set criteria for you. So when they actually I've done mock interviews before, and the way in which it works is you've got a mark scheme of boxes that an interviewee needs to tick. And if they start to go off topic a little bit, you interrupt them and you ask them another question on the thing that you want them to talk about and see if they can tick those boxes or not. So in that sense, an interviewer is just tasked with extracting information from you. So don't be scared or don't be annoyed or don't be upset if you get interrupted, because it is something that you can expect, okay? So expect to be interrupted. Something else is fear. Interviewers, some of them, like I said, are going to wake up on the wrong side of the bed that morning and they're going to be a little bit mean. Some of them are purposely just going to try and scare you by interrupting you on purpose, etc., etc. You've just got to accept that that's a harsh reality of interviews and you're going to be under pressure as a doctor or a dentist, so you may as well get used to it now, okay? So that's the third point. The final point of an interviewer is to essentially support you. They don't know you, they just want to squeeze your answers out. And their role, remember, is just to squeeze answers out of you. So it kind of combines what I just said previously together, but an interviewer's job is just to help you get the answers out and say the right things. So don't worry if they're being mean, don't worry if they're interrupting you, don't worry if they're telling you you're going off topic. They're there for your benefit, okay? Anything you guys want me to elaborate on, of course, let me know in the chat. If you're on my TikTok, please feel free to join the Discord server on bit.ly/UKMedApps. We'll head on to the next part of this. So, let's take a look at an answer to the question, why do you want to study medicine? I'm going to read it out loud for you guys. You guys can read it yourself after. I'll give you a little bit of time. But let's take a look. I've really liked medicine since a young age, but particularly began to become interested after my grandfather was diagnosed with TB. I spent a lot of time in the hospital and saw how important doctors are. I did work experience for 1 week in an A&E ward, and I was really impressed. I saw loads of cool things like taking bloods, surgery, and more. Medicine's definitely the career for me because I really enjoy all of these things. I'm also a volunteer in a care home, and I've spoken to a lot of ill elderly people before, and this will be really useful in speaking to patients when I'm a doctor. What do we think of that answer, guys? Let me know in the chat. What do we think of this answer that's in front of us right here? Do you think it's good? Do you think it's bad? Is there certain parts of it you'd take? Is there some certain parts of it you would remove? Amanda's saying there's no flow. Zainab's saying there's not great. Aria says kind of shallow. Katie says meh. Phantom says below average. Mohammed says it's basic. You're all getting the right thing, yeah? That's exactly what I wanted to get. There's no reflection here. There's no flow between the paragraphs. And you know how bad it is? It took me 45 seconds to write. So that shows you how little thought went into it. So in that sense, there's barely anything good to pick from this. The only thing that you could have taken from this answer is essentially the way in which I said it. And I just said it with a bit of confidence. And I just said it like a normal person. One thing I also wanted to say was, don't speak in your interviews in a monotonous voice. I've really liked medicine since a young age, but particularly became interested after my grandfather was diagnosed with TB. You're not a robot. You're not AI. You're not a fake person. You are human. Expression in your voice is so important, so don't forget it. You might feel a bit anxious. You might feel a little bit nervous, but don't forget to essentially show that you are a human being. Angela said on TikTok, I would say the work experience thing would be in your personal statement, so nothing new. That is true. However, at an MMI or at a panel interview, the probability that your personal statement's been read by the interviewer is so low. Your work experience is integral to most interview answers regarding motivation to medicine. So you need to make sure your work experience is mentioned, okay? Don't think to yourself, I'm not going to talk about this because I mentioned it on my personal statement. Because your interviewer, the likelihood of them reading your personal statement is very low, okay? So make sure you don't do that. Of course, if they question you on a certain part of your personal statement, that does mean that you've shown it already. But again, they want to put a face to your case, essentially. They don't just want to know that you can write things out, they want to know that you can say them. Is there a thing as smiling too much? If you just sit there, like, not blinking and just smiling from ear to ear, I think that would be a little bit creepy. No, I'm joking. But there's nothing wrong with smiling too much. Just do what's natural for you. You don't want to end up smiling so much to the point where you're kind of damaging your answer in doing so. You don't want to be thinking, oh, I need to smile before I start this paragraph. Oh, I've forgotten to smile. Let me start doing that again. If it comes naturally to you, awesome. If it doesn't, it's not deep at all. Don't worry about forcing it into your answer because you might end up focusing so much on it that you take away from the quality of your actual answer and the quality of the other parts of your delivery. So yeah, this was a question that got an answer and it wasn't really the best one possible. So let's take a look a little bit more. Before we continue though, do you guys want a little bit of a break? It's been 45 minutes. Do you want just a few minutes to get some water? Just to sit back for a few minutes? Let me know in the chat. Or we can just chug straight on. What do you guys think? And don't follow the crowd if you want to, right? Don't wait for someone else to say something. Just say it. Need to pray. Okay, there's not too much left, so what time is it? Yeah, it won't be Isha by the time this is finished. Definitely not. So, if you want to pray, you can come back after. I'm gonna send slides, but because most people have said they're happy to continue, I'm gonna chug on. So Yeah, I will send the slides after on, but I'm not planning to go on for too much longer either. So it's up to you. Okay, cool. Here's another question, and here's another response. Careers in medicine are long. What makes it think that it's the right one for you? So straight away, we're kind of thrown off by this question because it says that at the start, it says careers in medicine are long. Why did he say that? Do I need to address that? Do I need to actually respond to that? Can I just talk about my regular why medicine answer? It's quite difficult to know. But what I've done is I've written an answer here for us to analyse again. So let's take a little bit of a read through it. The length of a career in medicine is definitely a long one, but I believe my motivations for medicine, combined with the ever-changing nature of the career, will allow me to continually remain motivated and to overcome these new challenges faced by the NHS and me as a doctor. From doctor strikes to treatment development, medicine isn't a static career, and this constant development and challenge is something that attracts me massively. I wanted to further my knowledge of medicine and fulfill my fascination, so I undertook a week-long work placement in the accident and emergency ward of a hospital. And during this work placement, I saw a plethora of consultations, procedures and discussions that interested me, and from a general perspective, I was really interested from the beginning after appreciating the diverse role of a doctor and the variety of healthcare professionals that you get to work with. One interaction that really fascinated me though was when a doctor spoke to a foreign patient who didn't fully understand English, and this doctor adapted his communication to be clear and concise, and this ensured the patient understood, and he also combined this with non-verbal gestures and models. He tested the patient's understanding through regular questioning, and this exemplified the skill of communication in medicine, and it actually allowed me to see a parallel with my own volunteering. Oops, there we go, yeah, so that's that. So, what do we think of this answer right here? Is it better? Is it worse? What do you like? What do you not like? What can we take away from this answer? And I did volunteering ... purely because I didn't want to go on for another slide and talk about some made-up volunteering scenario. But yeah, what do we think of this question? Very good, better than the last one. Definitely hit the reflection tick box there, 100%. What about this question is there that you'd want to take away from it in terms of, does it answer the question? Well, yeah, it does. Careers in medicine are long. What makes you think this is the right one for you? This is, again, just the question, why do you want to study medicine, but rephrased. And initially, you might look at this and be really, really worried, but you might think to yourself, oh my gosh, I need to address the idea of time, I need to address this concept, that concept. But it's asking you the same thing again. Why do you want to study medicine? You just need to change the start one as Casually Blues identified. You just need to change the start of it a tiny bit, just so the interviewer knows that you're not giving a generic run-through of an answer that you've memorised before. And we can see that start when the person who answered this question said the length of a career in medicine is definitely a long one, so they appreciate what it is. Don't you have to answer that it's long though? Yeah. So the length of a career in medicine is definitely a long one. Yeah, no worries at all. So at the start of the answer, we just sort of adapted it a tiny bit to appreciate what it is that the interviewer was saying. So this question, we see it, we're asked it, and we know, okay, this guy just asked me why medicine again. He's just phrased it a little bit differently. Where will you send the slides when the live ends? I'm going to send it on the UK MedApps Discord server. You can find it on bit.ly/UKMedApps. So the link's shortener, bit.ly/UKMedApps. You join that Discord server, they're going to be there for you. So, they say this little thing at the start, and so many people are going to get thrown off by this. But what you need to remember with every single question that you get asked is, you have got the knowledge to answer this, you've got the skills to answer this, you've got the ability to answer this. Because at the end of the day, they wouldn't be asking you to do it if you couldn't, okay? So you look at the start of it, you just appreciate it a tiny bit, and make the interviewer know that you're not running through a generic run-through of an answer you've said a million times, and just go through your answer. So, it comes back to the idea of the talking point method that I was talking very briefly about before. You've got talking points and you want to be able to transfer them between different questions. So, your work experience. you've got that scenario in your head. It's not just an answer to why medicine, it's an answer to what did you see in your work experience. It's an answer to have you seen communication in medicine. It's an answer to what's the importance of teamwork within medicine. That talking point about your work experience, while it is an integral part of your why medicine answer, you can transfer that over to many, many different questions. And as long as you have the flow between those paragraphs, you're going to do really well. So this was an answer that we saw, and it was a lot better than the last one. Could you explain issues within medicine to show you've researched into the career and that you've considered all the sides? 100% you definitely can. However, this question is not mainly focused on that. If someone wants you to talk about what are the issues facing the NHS in the next 25 years, or what are the 3 biggest issues facing the NHS right now, they're going to explicitly ask you for it, okay? And that is something that I was tested on in my interviews, and when I was tested on it, they asked me very, very explicitly about it. So that when you have a question like this, again, an interviewer is just there to extract information about of you. They just want to make these questions as simple as possible so you can know what to talk about. They don't want you to be stuck on, oh, am I talking about the right thing? They want you to be stuck on, have I said enough? Okay? That's the big thing. So yeah, that is an answer to this question, and it was a lot better than the last one. So I'll send these slides across afterwards. Take what you want from this. Of course, make your answer unique to yourself. Please don't sort of copy this, because it's not going to benefit you at all. You want to develop the skill to be able to talk on the spot without having to memorize things. Because, I don't just say that because, oh, I'm being spiteful because people are memorizing answers. No, because you're going to get asked questions you've not prepared for, and it's a given. So, in that sense, if you have the ability to be able to talk through these talking points that you've worked through before and not be sort of flustered by these new questions, you will be a lot more adaptable and a lot better. So that is bringing me on to the question mindset. You want to have these transferable talking points. So when we talked about this before, we talked about how you've got your introduction, your work experience, your volunteering, and a conclusion. That was the journey of this answer. And you don't want to think about it as, I've got one answer to this question. You want to think of it as, I've got 5 talking points about this question, 3 of which are transferable. So let's think about your work experience like I was just saying to you. I've given this a flexibility, all 3 of them, 10 out of 10. Because your work experience, where you say, well, in this, I did a work placement on accidents in an emergency ward, and I saw quite a few really interesting things. One of the scenarios that really interested me was the interaction between an elderly patient and a geriatrician, or something else. That specific example can be translated over to so many different questions like personal qualities, ethics, professionalism, and more. And you might be thinking, okay, well, how is it going to be used like that? Well, for example, in personal qualities, we sort of touched on it before. What is the importance of communication within medicine? What's the importance of teamwork within medicine? Can you tell me a time that you saw it? That is very, very common. In ethics, why is empathy important within medicine? Can you tell me about a time you saw the 4 medical ethical pillars being used? In professionalism, how does a doctor manage his workload? How can a doctor ensure that they're efficient in what they do? And there's loads of other times you could be asked it. So if you've got that work experience point ready, you can put it into the answer for any question that you need to put it into. Where can I find the link to the Discord server? It's bit.ly/UKMedApps, okay? So just like my name's iHelpMedApps, the Discord server is called UK MedApps. You can either Google UK MedApps Discord server, or you can go to that shortened URL that I've just given you. And then you've got your volunteering. Again, that can be applied to so many different situations like situational judgment, personal qualities, and more. And it's got a 10 out of 10 in terms of flexibility and your confidence. Your confidence is something that you can develop in this easy question, and then you can push it onto other questions as well. So let's say you've done one MMI station and you've just banged it out. You've just talked about why you want to see medicine. You just talked about what you saw in your work experience, what you did in your volunteering, and you talked about personal qualities that you developed during your volunteering. Now you've got your next station. You're full of confidence. You're ready to answer any questions, okay? So doing well on this station is why I say doing well on another one is very, very easy to do, because it just sets a really good tone for you to move on from. But, of course, the reverse also goes as well. If you didn't do as well as you want to, don't worry. You've got 6-7 stations for you to make that up from. Every station is independent of the last one. And that's why this work experience point is super, super flexible. Probably an 11 or 12 out of 10 compared to volunteer. Even volunteering is an 11 or 12 out of 10. Because when you're going from one interviewer to the next, you can talk about that same work experience example again. And in fact, I did for every single one of my interviews, because they're not going to know that I just talked about it to someone else in a different context. So you just move between the stations, and you can keep that example the same. And that is everything for today. So now we're going to move on to the question and answer session. If you've got any questions for me about interviews, medical school, anything else, then yeah, just let me know. That's my TikTok, of course. I help med apps. I really appreciate it if you just set me a follow on there, because it makes sure that I can make the best content possible for you guys. And we've got a practice session this Sunday at 5 p.m. on this server. So on the UK Med Apps Discord server, again, if you're on TikTok, just search for UK Med Apps Discord server on Google and you'll be able to find it. But you'll be able to find the server, and I'll be asking questions this Sunday, and I'll be giving you critique for the answers that you do, and you can also see what other people do. Let's have a little look at the questions now. Could two universities ask the same question but both be looking for different answers? They could, but the differences they're looking for are going to be so minute that if you're following this method that I've given you and you're following this structure, you're going to end up covering both of them anyway. And if there's something that's really, really different, there'll be a follow-up question that specifically asks you about it. How did you handle preparing for both dentistry and the medicine interviews? I applied to both. In terms of medicine and dentistry, I'd say the overlap between the interviews is about 65 to 70%. It is very, very high. So if you've applied to 4 medicine and 1 dentistry like I did, then just a week before your dentistry interview, take a look at a few big things within dentistry. So the ethics side is going to be the same, the professionalism is going to be the same. Just remember that you need to know specifically, preferably about dental work experience, and you need to know about specific dental organisations, so like the DDU, the GDC, all that sort of stuff, okay? So make sure you've got the dentistry specifics ready for a week early. And you've practiced talking about them both as well. Would it be bad to say dental simulator games on Friv was my motivation to do dentistry? It's actually the reason I want to do it. No, not at all, honestly. I think that's really unique. It's actually pretty sick. And for me, one of the motivations... So, I was tested on my motivation to study dentistry in my interviews. And for me, I actually said... well, I've been building computers ever since lockdown, and I really appreciated, using my hands and developing manual dexterity. And it honestly got me interested in dentistry because it paralleled dentistry as a career. That's genuinely what I said in my interview. I just said I really enjoy building computers, and it's a skill that I've developed a lot. So I just thought about dentistry. So yeah, you can say whatever it is that you want, as long as you don't make it too informal in that sense. So you don't just say, yeah, I played Dental Simulator on Friv, so I wanted to become a dentist in it. No, you don't want to say it like that. But you want to more go for the angle of, so I initially became interested in dentistry through online simulation of being a dentist, and it got me fascinated in the variety of dentistry present, whether it's doing root canals, whether it's doing fillings, and the variety of patients that you can see. And to further my knowledge of this, I undertook a work placement at Chadbeck Dental Practice to find out more about dentistry. And during this work placement, blah, 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 blah. You see how I did it? It's easy. Once you get the hang of it, it's perfectly easy. Just make sure it's nice and formal. Okay, thanks. No problem at all. No problem at all. I'm on a gap year, and the only dental work experience I managed to get was a week last year. Would it be bad if I don't have any more? Not at all. My dental work experience was only a week as well, and my medical work experience was longer, but it didn't make a difference because you're never going to get asked how many weeks did your work experience last for, how many hours did you volunteer for, and even if you do, whatever you say, they're not going to say, oh no, you're getting rejected because that's not enough. That's never going to happen. As long as you've got some scenarios, 2 or 3 to reflect upon and talk about in your interviews, you are perfectly fine, Zainab. Don't worry at all about it. Is saying something like a friend suggested I do medicine a good idea? I do have other examples. I didn't mention this, and I talked about relative illness. I wouldn't say a friend suggested I do medicine. Instead, I would say, and I became interested in medicine after speaking to some other people involved in healthcare, or I became interested in medicine after doing a bit of research online. Saying that a friend suggested it takes away from the value of you wanting to study medicine or dentistry, because it's kind of like, oh, well, you're only here because your mate told you to be here. It gives that sort of impression, so you don't want to do that. No worries, Zainab. Mand has asked, how much knowledge do you need to know about the medicine scene, like when you mentioned the future medicine? Okay, yeah, this is something I wanted to talk about as well. I didn't do a specific slide about it, but you will get imposter syndrome when you speak to other medicine applicants, because there's going to be some guys there who know about some article written on the 7th of January in 1946 at 1:17 p.m, okay? There's going to be people like that who just know absolutely everything, and they just make you think, what the hell, man? I don't know any of this. In terms of the future in medicine, all you need to do is go on Apple News on your phone or whatever Google News is on Android, and legit just go onto the health section and just read through what it is that's happening in the world right now. If there's something really big happening in the world right now, the likelihood is you'll see it on TV. So honestly, don't worry about it too much. And I'm going to go through a specific hot topic session as well, hopefully, and I'll go through everything that you need to know in terms of the future of the NHS, the structure, hot topics, all that sort of stuff. So you'll have those slides in the future, and it won't be too far away, but yeah. Thank you so much, no problem at all. Are there any more questions for today? And these can be questions about anything, about medical school, dental school, the actual Discord server itself. It was a really good game. You could do fillings, extractions, composite bonding, and even veterinary dentistry. So it was good. A lot of people said it's a bad idea, but thanks for showing me how to incorporate it into my answer. No problem at all. But just don't say it was a game. Just say it was a simulator, because it gasses it up way more. It makes it seem way cooler. Have you heard about Keele Med? Yes, I've got a friend doing medicine at Keele. They send out interviews very, very late, so don't expect it soon. How should I be revising for a Cambridge medicine interview if you know? Congratulations on getting your interview. I actually interviewed at Oxford, but unfortunately I was unsuccessful. But as someone who was unsuccessful, I think the best advice that I can give is don't focus on learning content off by heart and crossing your fingers and hoping that it comes up in the interview. Just keep telling yourself and keep sort of working on expanding your thinking methods. So when you have a Cambridge medicine interview, that is them. It's not them saying, we want to see if you're good enough to study medicine at Cambridge. Because if you have got an interview from Cambridge, you are good enough. But the question actually is, how well are you going to adapt to our learning style? So take a look at Cambridge tutorials and how they work, and just try and follow along with some of them, and follow along with some online, whether it's, or maybe someone who's a Cambridge medical student or an Oxford one, you can ask them for some help. But yeah. Another thing is that right now I've got 2 offers for my gap year, a teaching assistant at a primary school and a dental receptionist, but the dental one's really inconvenient to commute to and the teaching one is really easy. Is it okay to take the teaching one, or should I try to get a job dental related? You don't need a job that's dental related at all. If you've got a job, then honestly well done for getting that job opportunity and that job offer. It's completely fine. You can talk about that teaching one. There's so many things you can talk about. Communication with young children, paediatric dentistry can be linked to it. There's a whole host of things you can link that to, so don't worry. When should I expect to get interviews by? It does depend on where you apply to, but generally you should be expecting to have done all of your interviews by April. For me, I did all of my interviews by February. So I did all of my interviews for medicine by February, and I did my dentistry interview in March. So yeah, March, April. If you apply to King's, you can expect interviews very late, especially if your UCAT's like in the 2800s, purely because their admin is just so slow. Haven't got an interview, I just want to prepare early. No problem, that's a good thing to do. Best of luck with that. Yeah, it depends on the universities. Like if you're King's right now, if you got a UCAT of 3,300 or higher, you will have received your interview. Yeah, it depends on the universities. Like if you're King's right now, if you got a UCAT of 3,300 or higher, you will have received your interview. We'll be doing sort of, yeah, I'll see you on Sunday where we'll be doing some interview preparation, and I'll be asking questions and you guys can practice answering them in front of each other. And don't be embarrassed or don't feel scared, because honestly, it's a really, really good opportunity. It's a really good opportunity. So don't lose it, okay? We all want to get into medical and dental school. Let's just work together and support each other in doing it, yeah? Will you be doing group discussions? Southampton does them. I did practice it for my interviews in case someone did it, but I'm not planning on doing a session on them right now, but if there's enough demand, then definitely I can do that. No problem at all. I think that is everything for today then. Any more questions, you can ping me on Discord at any time. You can send me a DM on TikTok at any time. Just some questions on here. Did you have any dental work experience? No. Yes, I did. What's weird about the Bristol interview? You get asked to do I'm not going to reveal it because non-disclosure and whatever, but you get asked to do what I've heard, practical medicine things, as opposed to I'm just saying what someone else told me. You get asked to do very practical medicine things as opposed to like more knowledge-based things. Did you do K+? No, I did not do K+. I wasn't widening participation, so I didn't actually have the opportunity to do it. But if you can do it, then I'm sure it'd be a great thing. But yeah, no problem, guys. I hope to see you on Sunday, and I'll be making an announcement very soon with these slides and everything about next week's session, next week's theme, everything else. In the meantime, you're more than welcome to just send me a DM on Discord, tag me here, or send me a DM on TikTok. But yeah, if you found the session beneficial, I'd really appreciate it if you gave my TikTok a follow at iHelpMedApps. I will see you guys next week, and yeah, best of luck with your interview preparation, and I'll see you this weekend, my bad. Yeah, I'll see you this weekend. See you guys, and best of luck. And yeah, that is also the TikTok live done as well, I guess. That's everything I wanted to talk about today, so hopefully it was of benefit to you, and I'll see you guys next week for the next teaching session. Thank you for joining, and see you all soon.